This is Jolie again. Today I'd like to look at growing an evidence-based nursing practice. As nurse leaders, we play an important role in the integration of evidence-based research into nursing practice. Healthcare organizations are dependent on nurse leadership for organizing the delivery of safe and quality patient care. It is with this in mind that Sonia Udid and Dean Kerr wrote the article Setting the Climate for Evidence-Based Nursing Practice. What is the leadership role? The purpose of this study was to look at a profile of competencies that are required for first-line nurse managers. That study was a descriptive exploratory investigation, and the study was done through a mailed survey. The questionnaires were sent out, and there were 400 of them sent out to first-line nurse managers in Western Canada. Of those 400, 117 completed surveys were returned. Kerr and Udid believe that an effective manager is able to develop 3 key skills that will aid in the development of evidence-based nursing practice. These skills are technical skills, human skills, and conceptual skills. Technical skills include nursing skills and techniques. Human skills are the ability to work with others. And conceptual skills is the ability to see how the whole organization works and with all of the parts coming together. With this in mind, the survey was sent including managerial competencies in 5 different categories. These categories were technical, human, conceptual, leadership, and financial. The results of this study showed that nurse managers have knowledge needed to understand evidence-based nursing practice. However, it is of lower importance to them. They also lack the ability to implement the evidence-based nursing practice into their nursing environment. As a result of these findings, 2 questions were raised. The first one is if nurse leaders do not think that utilizing evidence-based practice in their workplace is important, how will it affect the staff nurses' ability to incorporate research into their practice? And the second question is, since nurse leaders share the responsibility of promoting research-based knowledge, how do we assist nurse managers in making evidence-based practice a reality? Let's look at the benefits of evidence-based nursing practice. By integrating research and practice, we ensure that care delivery is consistent with every patient, and this makes sure that everyone is getting the safest and best quality care. The question is always asked, is nursing a profession or an occupation? When nurses' basis of practice in evidence, it cements our professional status and it secures a role in the nursing leadership of healthcare. Most importantly, basing nursing practice in research and evidence improves quality of care and improves patient satisfaction. It allows patients and families to be active participants in their own healthcare. According to Kerr and Unid, barriers can be divided into 3 main categories: individual, organizational, and environmental. Individual barriers include the competence of the nurse manager. Are they comfortable in the workplace that is highly skilled and analytical thinkers? Do they have the ability to apply research to practice? Lastly, are the nurses so overworked or too exhausted to take care of patients the way they wish to? Organizational barriers include limited access to evidence, nursing shortages, and lack of resources, combined with a need to develop the skills to efficiently research, and this creates many barriers in applying evidence to nursing practice. Management has not made evidence-based nursing practice a priority, and they're very focused on recruitment and retention. Environmental barriers include influences from society such as healthcare reform, massive cutbacks, and nursing shortages. After all the changes due to the healthcare reform, nurses are resistant to further changes. Part of these changes have been a shift from professional role into a managerial role, and shifting in the opposite direction of any evidence-based nursing profession. Keeping with these same categories, let's look at the role of a nurse leader. As an individual nurse leader can be a role model for evidence-based changes. They can create a networking opportunity and encourage collaborative atmosphere. They can support a shared leadership environment and give staff nurses more input into nursing practice. And they can support evidence-based practice with both words and actions. An organization promoting evidence-based changes needs to be supported by management, and a culture should be created to substantiate that. Nurse leaders should encourage evaluation of client outcomes and question if the current practices are the best. Access to resources for research should be easily accessible. Nurse leaders should position themselves as facilitators for training and development of evidence-based nursing practice. And leaders should incorporate rewards and recognition with evidence-based changes. Creating an environment of evidence-based practice is shown to improve patient outcomes and is cost-effective, ensuring that it is a valid resource. The environment is created by establishing a questioning culture. Are we doing what is best for our patients? And are we giving the best care? These are questions we should be encouraging, not censoring. An environment that embraces learning will always try to do what is best for the patients. That is what evidence-based nursing practice is all about. Evidence-based nursing practice is needed to give safe and quality care to our patients. As nurse leaders, it is our responsibility to cultivate and grow our own evidence-based nursing practice and to build an environment where it can flourish. Thank you.